So, as part of our contribution to the brain economy, we at the University of Sydney's Mental Wealth Initiative are really focused on ensuring that the conditions that foster brain capital are more visible in economic policy. So, with mounting challenges, leaders around the world are recognising that prosperity in this century will depend on whether nations can foster resilience, adaptability, innovation, and foresight, qualities that comprise brain capital. And while brain capital can be strengthened by interventions targeted at individuals, whether it be through better education, better nutrition, new treatment, or technologies, these represent only part of the potential. Because evidence shows that brain health and mental health are profoundly affected by the social conditions in which we live. And so this is really an issue, an area that's too important to ignore. Especially because these social conditions are eroding. Social cohesion is in decline. I think we heard this morning that loneliness is now described as an epidemic, inequalities are rising, and trust in institutions is fraying. So these are not isolated trends. There's evidence to suggest that they are structural consequences of optimizing economies to grow GDP. And so for decades, efforts have been made to move beyond GDP. As the dominant measure of progress. The intent was right to capture what GDP leaves out, but there are now 213 beyond GDP frameworks, indices, and dashboards. And while these indicators offer important insights into the different dimensions of well-being, they have not shifted GDP dominance. Why? Because GDP, for all its flaws, has conceptual clarity. It tracks flows of monetized productive activity and capital expenditure. It is globally standardized, and it is deeply embedded in the machinery of fiscal and monetary policy. Dashboards and indices, by contrast, mix together stocks and flows, inputs and outcomes, and subjective and objective measures. And so creating a kind of conceptual inconsistency that means that they really sit outside national accounting systems that drive economic decisions. So they generate important insight but limited policy influence. The concept of social production is different. Rather than competing with GDP, social production continues the historic evolution of GDP by expanding the boundary of what we count as production. It monetizes the unpaid activities that create genuine social, environmental, and economic value, but remain invisible in the current economic frame. Whether it be grandparents caring for grandchildren, older adults mentoring young people, volunteers contributing to community health, providing community health support, or Indigenous people's stewardship of land, water, and biodiversity, evidence suggests that engaging in socially productive activities strengthens mental and physical health, it reduces healthcare pressures, it supports workforce, economic, and environmental resilience. So measuring social production builds on existing national infrastructure, digital tools, and a published method. So it's not a distant aspiration, but an immediate capability. One that turns the invisible foundations of brain capital into a policy lever that governments can invest on and act on. And the time to advance this agenda is now because momentum is building. Last year, the World Health Assembly adopted a special resolution on the economics of health for all, which recognised the inextricable link between economic policy and health, and called for economies to be realigned so that they strengthen rather than erode the foundations of our well-being. Last year, the UN General Assembly, through adoption of the Pact for the Future, formally recognised the limitations of GDP and called for new measures. And in January this year, our joint report on the social production of Norway was launched during the World Economic Forum in Davos at Brain House. And recently, my colleague, Dr. Ante Prodan, and I just come from meetings in Switzerland and Europe, where we met with government ministries, multilateral institutions, and policy organizations. And we're very grateful to Pavel for having facilitated some of these critical meetings, particularly with the European Commission. Where we really found there was a genuine the people were genuinely receptive to these ideas. But it's not just relevant to nations. Social production offers organizations a practical way of measuring their invisible value. By tracking and promoting their social production, organizations can build trust, loyalty, and their social license. They can monetize their contributions to community well-being, and they can strengthen their positioning with government and funders, which is really important in these times of uncertainty. And widespread adoption could help normalize the concept of social production and support us in our efforts to have it integrated into the national accounts. And that's why we at the Mental Wealth Initiative are so grateful for the leadership of Crisis Text Line in setting the very first example of how organisations, whether they be large or small, can contribute to the brain economy by valuing their contributions to a nation's social production. And so I'm delighted to hand over to Margaret just now, who will showcase this work that we're so proud to have undertaken in partnership. I'd also like to say special thanks to these people on the screen, Pavel, Kristen and Tracy, who have contributed importantly to this work, and to Harris, who was instrumental in making the connection between Margaret and I, which set the ball rolling. Both Pavel and Harris provide play an important advisory role to the Mental Wealth Initiative. Thank you.
Thank you. So thank you so much, Joe, and thank you all for being here, coming together. It's just an amazing opportunity to be in the room with these great minds that are converging around putting puzzle pieces together that I think really do have the opportunity to change the world in very short order. I'm super excited to share a sneak peek of some of the efforts that we have underway on the social production value of the Crisis Text Line model. Let's see. There we go. First, I want to share a little bit here about Crisis Text Line model, what we do, how it works, and a sense of our global network and impact footprint to date. You heard, if you were in the room earlier, you might have heard Dina Trujillo talk a little bit about what we do. But essentially, we're a tech-forward nonprofit. We provide free 24/7 quality text-based mental health support and crisis intervention to anyone, anywhere. Your crisis is our crisis. Just come in. Texters are supported in our bespoke platform in multiple languages by real people. We don't use bots to replace people. We use technology to help human beings relate to, help, and support other human beings faster and more effectively. And we do use AI and machine learning a lot. We have clinicians who code. I call them my team of unicorns in the organization, who help us essentially use AI and NLP as a stethoscope to listen to what's happening in those conversations, derive insights that we can then use to improve our service, put out research that helps support the field, and improve our response to this kind of crisis worldwide. Together with our partners in Canada, Ireland, and the UK, we're one of the largest text-based volunteer training and crisis intervention networks globally. And now, as of just this week, we've announced that we are expanding to all of the Spanish-speaking world. In theory, that means 9% of the world has access to this kind of support. We'd like to see that grow exponentially in the coming years. 1 second, sorry. Lost my... There we go. Now, let me just give you a like feet on the ground sense of what that impact looks like in just the US last year. And so we are a tiny nonprofit in the US relative to the world, about 230 employees total. 80 of those are clinicians of some sort, mental health professionals on staff. Those 80 staff last year supported 16,000 trained volunteers who logged into our platform on 2-hour shifts whenever it worked for their lifestyle to support nearly 1.5 million crisis conversations across the country in every state and every county in the US. What's more, we know from our recent research on the volunteers themselves that they don't turn off those skills. They go home to their schools, to their family, to their workplace, and to their community. And we estimate at very minimum that for every conversation supported in crisis in our platform, our volunteers are supporting someone else outside that. So that's 3 million conversations or moments of crisis last year, supported or averted by that tiny pool of 80 clinicians. That kind of model is scalable worldwide. People who care can be found everywhere. And so that's what we're trying to expand and move around the world. So I'm going to give you a little sense of our global numbers at a high level. We've supported about 15 million crisis conversations across the 4 countries where we've been operating so far. As you can see, 87% of those who reach out to us, the texters reaching out in crisis, find that single moment of average 45-minute conversation exchange helpful for them in that moment. And there's more information there on the slide. A few years ago, around the 77th World Health Assembly that Joe mentioned, we started taking a deeper dive into understanding more about the effects of our model on the texters who reach out, the volunteers who come and support them, and their communities in a cascade way. And so in addition to turning around and supporting people in their daily lives, over 96% of our volunteers report that their own mental health and resilience has improved. 99% report improved active listening skills and greater empathy. 91% say it gives them, helps them gain a sense of community. 80% say that it strengthens the quality of their work relationships. These are just a few of the things that they're telling us that they attribute directly to this experience. Our findings align with what Joe mentioned earlier, that this evidence suggests that engaging in this socially productive activity strengthens mental health, it reduces healthcare pressures, and it supports workforce and builds individual and community resilience. So for more specific examples, we have a lot more research that's been published on our website. I'm happy to share if you don't find it easily. There is a link on the screen. So I'm going to jump ahead to, I was lucky enough to be in the audience in the 2025 Brain House during the World Economic Forum when the report on the value of social production in Norway was shared. And I sat there and immediately wondered what it would look like if we could try and take that framework and apply it to the work that we do. Soon after that, when Jo got back from her leave, we jumped on a call and started to figure out how we might approach this. Basically what we've looked at is just the volunteer hours logged in our platform. So conservatively, what we can tell start time, end time. It's in the platform, that's not an interpretation. And we also collaborated then with our partners, Kids Help Phone, Spun Out and Shout, who've adapted and have been implementing the same model in Canada, Ireland, and the UK, so we could quantify the hidden economic value generated across these countries. And then we also took a deeper dive and looking into the US to see what we could learn about which populations are driving that value. And we're preparing a set of 2 reports that we plan to launch in January, again in Davos, that I'm just going to give you a sneak peek of what's emerging here. Before I do that, I'll dive into one of the lessons. We come from a very different discourse than many people in this room. And trying to socialize the idea of social production, that's a little bit challenging. I think it was Allison who earlier today touched on the importance of semantics and figure out how to thread the needle of identifying meaning that makes this, that means the same thing across different discourses. So in our sort of focus groups and our working groups, the idea of social production to some felt like chewing cardboard. Didn't mean anything to what we do every single day, right? The idea of social prosperity value is something that's not transactionally production oriented, but it's like we're building, prosperity for people. That seemed to capture a little bit better nuance. Um, but we also know that that's getting geeky and looking at our own navels. And so we landed so far on economic value. We're super open to suggestions and would love ideas from others in the room. How do we tell this story? How do we convey these concepts so that it means something, it's easily digestible and understandable by anyone in the room? So that was one of our first lessons. Then looking at what's emerging in terms of the scale of the value contributed to communities across these 4 countries is staggering. We've had 7.4 million hours donated across these 4 organizations in the last 7 years. If you add the early years of Crisis Text Line operating the model alone, it's over 8 million. That's a millennium of people time. 1,000 years of someone's life has been contributed to this model. That converts to $186 million in economic value, 28 million just in 2024 across these 4 countries. We also find that there's consistent value creation over time across diverse economic and social conditions within those countries. And really importantly, we find that it's resilient during periods of acute need. During COVID, we saw our volunteers spike, the value spiked up with it, and we saw that recede a little bit, but still stay high in most of the contexts that we're working. So it endures. Even, this as an intervention is resilient against those kinds of shocks. So that's on the global level. Then let's look a little bit about what we're seeing in the United States, where we crosswalked with the sort of profiles of our volunteers. Some pretty amazing insights are coming to the fore for us. Total value for us since the initiation of Crisis Text Line, which is different. The frame, because Crisis Text Line started in 2013, the other organizations adapted and implemented the model in 2018. So the first 5 years for the other organizations don't have any social production value behind it. But Crisis Text Line alone, since we were born in 2013, $164 million, $21 million in 2024 alone. That is more than half of our operating budget for the whole organization. And within that, the primary drivers, who are the volunteers that show up every day, those 16,000 and over the 120,000 that we've trained worldwide. In the US, young adults. They generated half that value, 18 to 20-year-olds, and more than any other age group. Women, also huge, nearly 4 times that of men, 13.8 million. And students, also almost half of this, more than any other employment category. Now, we pegged the employment category to their employment when they applied to become a volunteer. So we didn't do change over time in that. We have other studies. Again, if you want to look at the volunteer impact, you'll see that this is not the only way that we're looking at our impact, but on the volunteer impacts, the reports that we've already produced, half of our younger volunteers that say that they use this experience, that this experience has helped them to get into an education or training program or to get a job. Many of them are moving into caring professions, including healthcare of some sort. So there are lots of relationships in terms of strengthening ecosystems. So this is, for us, quite revelatory. This is your sneak peek. Josh, if you're in the room still, I think you know from Dina and Brian, who probably raced to find you at break, that we're excited to connect with you and follow up. So what are the contributions to the brain economy? Lots of things that we think we can begin to tease out and pull. How communities can mobilize the social production of care to address critical service gaps wherever they are. Whatever the base level of resources in that community, volunteers can be mobilized. Delivers immediate support to individuals in crisis while also building that long-term social capital that's essential for healthy, resilient communities. It's a 2-for-1. Something in the moment and something that's going to endure long-term. Highlights an essential pathway for increasing brain capital and sustaining and even increasing care services when professional workforce capacity is constrained. So one of the other earlier panels said, how can we do all these things at the same time? This is one example of a few things that can be done at the same time. And it's scalable, cost-effective, and eminently so. And it visibilizes, I think, substantial economic value generated by populations whose work is traditionally undervalued. In fact, some of these demographics are considered a burden on economies, right? And we're seeing that there's great contribution coming in from perhaps some unexpected places, which means we have opportunities out there. So stay tuned for more in January.